Doctors usually tell you to cut back on salt or take your medications properly to improve heart health, but they don't go into details about how much minerals matter for heart patients. Without the right minerals, your heart won't pump as efficiently, blood vessels get stiffer, and complications can creep up faster. Here's the crazy part: most heart patients are low on these key nutrients without even realizing it. Ever feel exhausted all the time? Deal with irregular heartbeats? Or struggle to get your blood pressure under control no matter what you do? Chances are your body is missing something important. Fixing that gap could make a huge difference in how you feel and how well you manage heart disease. Let's get into which ones matter most and how to make sure you're getting enough every day. First mineral, magnesium. Now let's start with the first one. Number 1, magnesium. Most people don't think much about magnesium, but if you have heart disease, it's more important than you might realize. Why magnesium gets depleted? Your body loses magnesium faster when blood pressure is high because stress hormones flush it out through urine. On top of that, inflammation and oxidative stress, both common with heart disease, push your body to use up more magnesium for cellular protection. High levels of calcium, which many heart patients supplement with, can also interfere with magnesium absorption, making it harder for your cells to maintain proper balance. And to make things worse, certain medications like diuretics, proton pump inhibitors, and some antibiotics deplete magnesium even more, which is why many heart patients end up low on it without knowing. Deficiency symptoms. The tricky part: a magnesium deficiency doesn't always come with obvious symptoms. If you're feeling unusually tired, struggling with muscle cramps, or dealing with anxiety and irritability, low magnesium could be a factor. One of the biggest warning signs is heart rhythm disturbances, palpitations, fluttering sensations, or feeling like your heart skips beats. Muscle twitches or spasms and persistent headaches can also show up since magnesium is key for nerve and muscle function. Insomnia, high blood pressure that resists treatment, and constant feelings of stress are other signs to watch for. In severe cases, low magnesium can even lead to severe arrhythmias, causing dizziness, chest pain, and shortness of breath. Effects on body systems. Magnesium deficiency can affect multiple systems in the body. It plays a big role in cardiovascular health. Low levels can increase blood pressure and arterial stiffness in men, while in women, it can lead to higher risk of stroke and heart failure. It also affects mood regulation since magnesium helps regulate GABA, the calming neurotransmitter in the brain. The nervous system relies on magnesium for proper electrical signaling, so without it, anxiety and stress responses can worsen, increasing cortisol and making heart issues more severe. The musculoskeletal system needs magnesium to relax muscles properly, and when levels drop, the risk of painful spasms and cramping goes up. Energy production can take a hit too. Magnesium helps activate ATP, your body's energy currency, and without enough, chronic fatigue and weakness can progress faster, leading to decreased exercise tolerance. The blood vessels and heart muscle are also at risk. Magnesium helps maintain proper calcium levels in heart cells. When magnesium is low, calcium overload happens, making arrhythmias and hypertension worse. Cellular level benefits. On a cellular level, magnesium is essential for over 300 enzymatic reactions. It helps maintain membrane potential so electrical signals in heart cells function properly instead of causing dangerous rhythm disturbances. Without enough magnesium, blood pressure becomes harder to manage and insulin resistance can get worse, which further damages blood vessels. It's also critical for balancing nitric oxide production, which explains why low levels can lead to vasoconstriction, reduced blood flow, and worsening angina symptoms. Magnesium is needed for protecting against calcium overload in cardiac cells, which carries oxygen in the blood. Without it, heart muscles contract too forcefully, leading to hypertension and increased cardiac workload. Food sources. The best way to get enough magnesium is through food. Pumpkin seeds are one of the richest sources, with just 1 ounce covering about 37% of your daily needs. Dark chocolate, 85% cocoa or higher, is another powerhouse, giving around 33% per 100 gram serving. Spinach provides about 39% per cooked cup, making it a great vegetable choice. Almonds deliver around 25% of daily magnesium per ounce. Black beans offer about 30% per cup cooked. These foods don't just help maintain magnesium levels, they also support stress reduction, muscle relaxation, and energy production, making them especially beneficial for heart patients. Gourmet meal suggestions. If you enjoy gourmet meals, some high-end dishes are packed with magnesium. A Mediterranean-style spinach and almond-crusted salmon, 180 grams salmon, 1 cup spinach, 2 tablespoons almonds, delivers over 45% of your daily needs while also supplying omega-3s for anti-inflammatory benefits. A French dark chocolate mousse with pumpkin seed brittle, 60 grams dark chocolate, 1 ounce pumpkin seeds, provides around 40% of daily magnesium along with flavonoids for improved vascular function. A Mexican black bean and avocado salad with lime dressing, 1 cup black beans, half avocado, mixed greens, delivers about 38% of daily magnesium while also offering potassium for blood pressure regulation. Supplement recommendations: if food isn't enough, supplements can help. The best forms of magnesium come in highly bioavailable versions like magnesium glycinate, threonate, or taurate, which your body can absorb efficiently. Pure encapsulations magnesium glycinate, 120 mg per capsule, is one of the top options since it absorbs well and doesn't cause digestive issues like some forms. Another great choice is Life Extension Magnesium Threonate, 144 mg elemental magnesium per capsule, which provides excellent brain and cardiovascular support. Most heart patients do well with 300 to 400 mg per day, but if you're considering higher doses, it's best to check with your doctor. Things to avoid: some foods and habits can actually make a magnesium deficiency worse. Heavily processed foods lack magnesium while containing high levels of phosphates that bind to magnesium, making it unavailable to your body. Alcohol acts as a diuretic that increases magnesium excretion while also impairing its absorption in the gut. Carbonated beverages, especially colas, contain phosphoric acid that binds to magnesium and prevents proper absorption. Excessive calcium supplementation without balancing magnesium can create an imbalance that worsens cardiovascular function. Chronic stress depletes magnesium rapidly as your body uses it up to manage the stress response, creating a dangerous cycle for heart patients. Summary: magnesium might not get much attention, but for heart patients, it's a game changer. It helps regulate heart rhythm, relaxes blood vessels, lowers blood pressure, and reduces inflammation, making it one of the most important minerals for overall cardiovascular health management. Second mineral, potassium. Number 2, potassium. Think of potassium as your heart's electrical balancing system, essential for every heartbeat, but here's the problem: heart patients often run dangerously low without knowing it. Why potassium gets depleted? Your body loses potassium faster when taking diuretics, water pills, which are commonly prescribed for heart failure and hypertension, as they flush potassium out with excess fluid. On top of that, stress and high cortisol levels, both common with heart disease, increase potassium excretion through the kidneys. A high sodium diet can also interfere with potassium balance, creating an unfavorable ratio that raises blood pressure and strains the heart. And to make things worse, certain medications like ACE inhibitors, beta blockers, and some diabetes medications can affect potassium levels significantly, which is why many heart patients have to monitor levels carefully. Deficiency symptoms. The tricky part: a potassium deficiency doesn't always come with obvious symptoms until it becomes severe. If you're feeling unusual fatigue, experiencing muscle weakness, or dealing with leg cramps, especially at night, low potassium could be a factor. One of the biggest warning signs is heart rhythm irregularities, palpitations, feeling like your heart is racing or skipping beats. Digestive issues like constipation or bloating can also appear since potassium helps maintain proper muscle function throughout the digestive tract. Increased blood pressure readings, feeling more thirsty than usual, and numbness or tingling are other signs to watch for. In severe cases, low potassium can even lead to dangerous heart arrhythmias, causing dizziness, fainting, and in extreme cases, cardiac arrest. Effects on body systems. Potassium deficiency can affect multiple systems in the body. It plays a big role in cardiovascular function. Low levels can increase blood pressure and arrhythmia risk in both men and women, with particularly strong effects on vascular resistance. It also affects muscle function since potassium helps regulate contraction and relaxation cycles. The nervous system relies on potassium for proper nerve signal transmission, so without it, nerve conduction problems can worsen, increasing pain sensitivity and coordination issues. The kidneys need potassium to regulate fluid balance and blood pressure, and when levels drop, the risk of kidney damage increases, creating a dangerous cycle. Blood sugar regulation can take a hit too. Potassium helps the pancreas release insulin properly, and without enough, insulin resistance can progress faster, worsening cardiovascular risk. The acid-base balance of the blood is also at risk. Potassium helps maintain proper pH levels. When potassium is low, metabolic acidosis can develop, making muscle weakness and heart problems worse. Cellular level benefits. On a cellular level, Potassium is essential for maintaining the electrical gradient across cell membranes. It helps regulate the sodium-potassium pump so heart cells can properly control electrical signals instead of firing erratically. Without enough potassium, blood vessels can't relax properly and blood pressure rises, putting strain on the heart muscle. It's also critical for smooth muscle relaxation in arteries, which explains why low levels can lead to vasoconstriction, reduced blood flow, and increased cardiac workload. Potassium is needed for glucose metabolism, and when levels drop, cells don't get enough energy, leading to weakness and fatigue that makes heart disease harder to manage. Food sources. The best way to get enough potassium is through food. Avocados are one of the richest sources, with just one medium fruit covering about 20% of your daily needs. White potatoes with skin are another powerhouse, giving around 23% per medium potato. Spinach provides about 12% per cooked cup, making it a versatile vegetable choice. Salmon delivers around 15% of daily potassium per 3-ounce serving. Bananas offer about 10% per medium fruit, making them a convenient option. These foods don't just help maintain potassium levels, they also support nerve function, muscle contraction, and blood pressure regulation, making them especially beneficial for heart patients. Gourmet meal suggestions. If you enjoy gourmet meals, some high-end dishes are packed with potassium. A California-style grilled salmon with avocado lime salsa, 180 grams salmon, half avocado, delivers over 30% of your daily needs while also supplying heart-healthy omega-3 fatty acids for reduced inflammation. A French fingerling potato and roasted garlic soup with fresh herbs, 2 medium potatoes, vegetable broth, herbs, provides around 35% of daily potassium along with nitrates for improved vascular dilation. An Italian spinach and white bean ragu with lemon and herbs, 2 cups spinach, 1 cup white beans, delivers about 25% of daily potassium while also offering plant-based protein for muscle maintenance. Supplement recommendations. If food isn't enough, supplements can help, but caution is essential as too much potassium can be dangerous. Always consult your doctor before supplementing. For those approved to supplement, potassium citrate is often recommended over potassium chloride as it's gentler on the stomach. Now Foods potassium citrate, 99 mg per capsule, is one option that provides a modest dose that can be adjusted under medical supervision. Another option is Thorne Research potassium citrate, 99 mg per capsule, which provides a bioavailable form. Most heart patients should only supplement under close medical supervision, typically with 99 mg capsules used according to their doctor's specific instructions, with regular blood tests to monitor levels. Things to avoid. Some foods and habits can actually make a potassium imbalance worse. Excessive salt consumption displaces potassium and creates an unfavorable sodium-potassium ratio that raises blood pressure. Highly processed foods generally contain high sodium and low potassium, creating the worst possible mineral balance for heart health. Alcohol is a diuretic that increases potassium loss while also potentially interfering with medications. Licorice root, found in some teas and supplements, contains glyceric acid that can deplete potassium levels. Excessive coffee consumption can increase urination and potassium excretion, especially when consumed in large amounts. Summary: potassium balance is critical for heart patients, but most don't realize how much it affects their condition. It helps regulate heart rhythm, lowers blood pressure, balances sodium effects, and supports proper muscle function, making it essential for cardiovascular health and recovery. If this helped, please subscribe to support our work. Let us know in the comments if you have any questions. Third mineral, selenium. Number 3, selenium. Selenium isn't something most people think about until they're running low. For heart patients, that happens more often than you'd expect. Why selenium gets depleted? Your body loses selenium faster when inflammation is high because inflammatory processes use up selenium-containing enzymes to fight oxidative damage. On top of that, certain heart medications, particularly statins, can reduce selenium absorption or utilization, making it harder to maintain adequate levels. Poor soil quality in many agricultural regions has led to lower selenium content in foods, so even a seemingly healthy diet might not provide enough. And to make things worse, digestive issues common in older adults with heart disease can impair proper selenium absorption, which is why many heart patients are deficient without realizing it. Deficiency symptoms. The tricky part: a selenium deficiency doesn't always show obvious signs at first. If you're feeling unusually fatigued, noticing your hair or nails becoming brittle, or dealing with brain fog, low selenium could be a factor. One of the biggest warning signs is weakened immune function, getting sick more often or taking longer to recover from illnesses. Muscle weakness and pain can also appear since selenium plays a key role in muscle metabolism. Thyroid problems, unexplained weight changes, and a general feeling of unwellness are other signs to watch for. In more severe cases, a deficiency can lead to heart muscle weakness and worsening cardiomyopathy, causing increased shortness of breath and decreased exercise tolerance. Effects on body systems. A selenium deficiency can affect multiple systems in the body. It plays a big role in thyroid function. Low levels can impair T3 hormone production in both men and women, affecting metabolic rate and energy levels, which further strains an already compromised heart. It also affects reproductive health since selenium helps protect egg and sperm cells from oxidative damage. The immune system relies on selenium for proper function, so without it, infection risk increases, which can be particularly dangerous for those with heart disease. The musculoskeletal system needs selenium for proper muscle metabolism, and when levels drop, the risk of muscle weakness increases, including in the heart muscle itself. Cognitive function can take a hit too. Selenium protects brain cells from oxidative damage, and without enough, memory problems and mood disturbances can progress faster. The body's antioxidant defense system is also at risk. Selenium is essential for glutathione peroxidase enzymes. When selenium is low, oxidative stress increases dramatically, making atherosclerosis and tissue damage worse. Cellular level benefits. On a cellular level, selenium is essential for producing selenoproteins that act as powerful antioxidants. It helps neutralize free radicals so cells can function normally instead of suffering oxidative damage. Without enough selenium, cellular damage accelerates and inflammation increases, making heart disease progress faster. It's also critical for mitochondrial function, which explains why low levels can lead to fatigue, reduced energy production, and weaker heart muscle contractions. Selenium is needed for proper endothelial function, the inner lining of blood vessels, and when levels drop, blood vessels become less responsive, leading to higher blood pressure and worse circulation. Food sources. The best way to get enough selenium is through food. Brazil nuts are by far the richest source, with just one nut potentially covering 175% of your daily needs, though content varies widely. Yellowfin tuna is another excellent source, giving around 92% per 3-ounce serving. Halibut provides about 67% per 3-ounce serving, making it a great seafood choice. Turkey delivers around 56% of daily selenium per 3-ounce serving. Cottage cheese offers about 27% per cup, making it a convenient dairy option. These foods don't just help maintain selenium levels, they also support immune function, antioxidant protection, and thyroid health, making them especially beneficial for heart patients. Gourmet meal suggestions. If you enjoy gourmet meals, some high-end dishes are packed with selenium. A Japanese sesame-crusted tuna with Brazil nut pesto, 120 grams tuna, 2 Brazil nuts, sesame seeds, delivers over 200% of your daily needs while also supplying heart-healthy omega-3s for reduced inflammation. French halibut en papillote with mushrooms and thyme, 150 grams halibut, wild mushrooms, fresh herbs, provides around 75% of daily selenium along with lean protein for muscle maintenance. An American smoked turkey and cottage cheese wrap with spinach, 100 grams turkey, 1/4 cup cottage cheese, whole grain wrap, delivers about 65% of daily selenium while also offering protein and complex carbohydrates for sustained energy. Supplement recommendations. If food isn't enough, supplements can help, but the right form matters. Selenomethionine is the organic form that's best absorbed and utilized by the body. Pure encapsulation selenium, selenomethionine, 200 micrograms per capsule, is a top option since it provides high absorption and supports antioxidant function. Another excellent choice is Thorne Research selenomethionine, 200 micrograms per capsule, which offers a highly bioavailable form. Most heart patients do well with 100 to 200 micrograms per day, but it's important not to exceed recommended doses, as too much selenium can be toxic. Things to avoid. Some foods and habits can actually make a selenium deficiency worse. Refined grains and processed foods lack selenium while potentially containing anti-nutrients that can impair absorption. Excessive alcohol consumption can reduce selenium absorption and increase excretion through urine. Very high-dose vitamin C supplements, over 1,000 milligrams daily, may interfere with selenium absorption when taken together. Heavy metals like mercury, found in certain fish, can bind to selenium and make it unavailable to the body. Smoking depletes selenium while increasing oxidative stress, creating a dangerous combination for heart patients. Summary. Selenium is one of the most powerful antioxidants for protecting your heart, but most people have no idea they're running low. It helps protect heart tissue from oxidative damage, supports proper endothelial function, reduces inflammation, and enhances overall antioxidant defenses. If your heart health hasn't been improving as expected or you're feeling unexplained fatigue, low selenium could be part of the problem.